How is smile eye surgery a flapless procedure? Imagine a way to correct your vision that keeps your eye's surface more intact than traditional methods. That's what makes smile eye surgery stand out as a flapless option. Unlike LASIK, which involves creating a large hinged flap on the surface of the cornea, smile uses a tiny, precise approach. It employs a special laser called a femtosecond laser to work inside the cornea, not on top of it. The laser creates a small, disc-shaped piece of tissue called a lenticule inside the corneal stroma, which is the middle layer of your. This lenticule is carefully fashioned to reshape the cornea and improve vision. Once the laser has made the lenticule, the surgeon makes a very small incision, usually about 2 to 4 millimeters wide. This tiny opening is much smaller than the flap created in LASIK, which can be around 20 to 30 millimeters. Through this small incision, the surgeon gently dissects and removes the lenticule, which causes the cornea to change shape and correct refractive errors like nearsightedness or astigmatism. Because the surface of the eye remains largely untouched, the procedure is called flapless. The key benefit of this approach is that it preserves the integrity of the corneal surface. No large flap is cut or lifted, which means less disruption to the nerves that help keep your eye moist and healthy. This can lead to fewer dry symptoms after surgery. It also helps maintain the biomechanical strength of the cornea, reducing the risk of complications like corneal weakening or ectasia, especially in patients with thinner corneas or those at higher risk. From a health perspective, especially for people concerned about conditions like glaucoma or macular degeneration, keeping the cornea strong and healthy is important. Because smile avoids creating a large flap, it reduces the chances of flap dislocation or trauma afterward. The procedure is quick, usually taking about 15 minutes per, and most patients experience rapid recovery with minimal discomfort. In summary, smile is called a flapless procedure because it does not involve lifting or creating a large flap on the surface of the eye. Instead, it uses a small incision to remove an intrastromal lenticule, which reshapes the cornea. This technique helps preserve the eye's natural structure, reduces nerve damage, and can lead to a smoother healing process. If you're considering refractive surgery, it's always best to consult with an eye care professional to see if smile is suitable for your specific needs.